The South African Health Products Regulatory Authority has approved an extension of the shelf life of the first 1.5 million doses of the Johnson & Johnson vaccine. The doses will now only officially expire towards the end of September, extending their shelf life for a month. They had been due to expire on Wednesday. There are fewer than 50,000 doses left of the one-dose vaccine that was primarily rolled out to healthcare workers as part of the Sisonke protocol. In more vaccine news, an investigation by the SA Health Products Regulatory Authority has found the deaths of 29 people who were vaccinated was not linked to having received the injections. Well, let's speak now to Professor Mosa Moshabela, Acting Deputy Vice-Chancellor for Research and Innovation at the University of KwaZulu-Natal. He's a Professor of Public Health and Nursing. Professor, good evening to you. Thank you very much indeed for your time. I would imagine these are careful investigations. There's a lot riding on this. They will have been very thorough. This is an important finding, that these deaths did not come from vaccinations.
Yes, absolutely. Greetings, Stephen, Kathy, and the viewers. Yeah, I think you would recall that last month when SAHPRA presented to the Parliamentary Committee on Health, they reported the 28 deaths that they were investigating. And of course, it also happened at a time when a lot of people were reporting deaths in social media and other circles in society that were seemingly associated with vaccination. And of course, the stakes are very high in terms of SAHPRA coming out and being able to tell us exactly what is the association between vaccination and the deaths. Just because that most people, if these things are not explained properly, they would assume that the deaths that happen after someone has been vaccinated are automatically caused by the vaccine. And that is something that we need to clarify. And I think, as you correctly say, that SAHPRA needed to actually go through these investigations in order to be able to respond to these questions.
To conduct a medical investigation like this, is it quite difficult to do? I mean, you would obviously need to find what the cause of death was, and then to make absolutely certain it had nothing to do with the vaccine.
So, yeah, I think normally if a death is not related to vaccines, we classify deaths in terms of natural deaths and unnatural deaths. And the moment a death is unnatural, like in terms of accidents, they would undergo post-mortem to try and identify the actual cause of death, or even if it's poisoning or something else. So it's common in medical practice and forensic medicine to investigate the cause of death. Now, in this case, the assumption is that when someone has been vaccinated, it may not necessarily be a natural cause because there have been a major event of a vaccine, if we know that the vaccines may actually lead to adverse events. And so whenever the doctors or health professionals report a death that seemingly is associated with the vaccination, it then needs to be submitted electronically to the South African Health Products Regulatory Body. It will be investigated together with the Department of Health, and then submitted to the National Immunization Expert Safety Committee, who will then look at the evidence in front of them and analyze it to identify whether there is causality between the vaccination and the death. And these things, Stephen, are done hopefully within a short space of time. I mean, the information we got from SAHPRA is that they try to get these investigations done within 48 hours. The committee sits every week in order to look at all these cases, and also preferably if there's also the potential link is identified in time, there could be some post-mortem results that have been that can be provided before a burial is done in such cases, because this, of course, would be classified as unnatural deaths.
One of the problems we have at the moment is vaccine hesitancy. I mean, there are so many people, many of them, I'm afraid to say, influenced by social media, who are worried about getting a vaccine. Do we now need a big communication program, a big communications initiative from government, from everybody else on this?
Yeah, I mean, it's a good point. I mean, at the moment, I think, especially in the past month or so, I think that the issue of concerns around adverse events, for example, and people not, being able to understand exactly what is the connection between the vaccination and the deaths that are being reported in social media. Those kind of that kind of information has really deterred people, discouraged in a way people from getting vaccination, and it can slow down vaccination. We know in South Africa, more than 75% of people are willing to take the vaccines, but every time there are reports of these kind of issues, if they are not verified, clarified by government and Department of Health and so forth, it will reduce that number of 75% to, I don't know, 60% or so, because a lot of people on the fence would then decide not to go for vaccination. So I agree completely. We need a much more organized system of communication, and for these queries and questions that people have, for them to be addressed very quickly. I understand that SAHPRA and Department of Health would launch a website specifically around providing results of these investigations in terms of adverse events, and I think that will be helpful to provide clarification. But we need more than that. We need really organized communication that is targeted at addressing some of these disinformation campaigns that are being driven in social media.
Professor Mosa Moshabela, as always, really appreciate the time. Thank you. In a moment.